Good night, everyone. Can you listen to me? Hi.
Good afternoon. Good night.
Okay. Can you see my screening?
Yes, we can, teacher.
Okay, thank you. I think we have a little delay here, right? Please let's be patient with the internet, okay? Okay. Today we're gonna start talking about another topic. It's called investigations. And as always, I will ask, please, Sergio, can you read this part for me, please? Hello, can you listen at me?
Yes, we can, Encinas.
Okay, thank you. Thank you, Sergio. Please help me out here.
Me? Sorry. Or who?
Yes, you, Sergio, please. Can you read this part? Oh, I don't know if you can listen to me.
A little bit, teacher. There is interference.
Okay. Then wait for me, please. I'm gonna get out of the meeting and I'm gonna come back, okay?
Okay.
Please. Okay, can you listen to me now?
Yes, teacher, we can.
Yes, teacher.
Perfect. I think now it's better. Okay. And now, Sergio, can you help me out here? with this part, please?
Yes, of course. Sorry,
Thank you.
my internet wasn't working very well.
No worries. It happens.
Yes. Ophthalmoscopy. An ophthalmoscope allows the doctor to examine all parts of the eye, the iris, lens, retina, and optic disc. For best results, the examination is done with dimmed or lowered lights to allow the pupil to maximally dilate or widen. A topical mydriatic solution may be applied to the eye to aid dilation. The patient is then asked to fixate on a target for the duration of the test.
Okay, thank you. As you can see, we have this kind of examination, the almost ophthalmoscopy. Okay. I don't know if you understand everything or you have any questions here for vocabulary.
Excuse me, Miss. What
Yes.
does widen mean?
Widen? Oh,
Why?
okay. Widen. To make it bigger. In this case, it can be the eye, the pupil of the eye. Do you understand?
Yes, thank you.
Okay, you're welcome. Any other question here?
Yeah, teacher, what does it mean, DMET?
For best results, the examination is done with dimmed or lowered light. Okay, dim, it would be an examination more specific. In Spanish, it can be called atenuado. Okay?
Okay, thank you.
No problem. Okay, any other question or you think we can continue?
Excuse me, Ms. Encinas, fixate would be like focusing on something, on something in a specific, or what would that mean? I'm not sure about it.
The patient is then asked to fixate on the target. Yes, to look on a certain point or to focus, no, right?
Oh, okay. Thank you.
No problem. Okay, so I think we can go on, right?
Yes.
Sure. Claudia,
Yeah, teacher.
can you read this part, please, for us?
Okay. Blood pressure. A stethoscope is used to hear the sound of blood rushing back through the artery. The first thumping sound is the systolic blood pressure, SBP. When the thumping sound is no longer heard, that's the diastolic blood pressure, DBP.
Okay, thank you so much. And as you can see, we have the parts of is sphygmomanometer, right? Here we have the gauge, the cuff, the pump, the valve. Okay, and for an stethoscope, we have the headpiece, the earpieces, the bell, and the diaphragm. Okay, do you have any questions here? I think we can continue.
Yes, teacher.
This is a long topic, so we don't have enough time. Okay, here, Valeria Guerra.
I'm sorry. I was on mute. Taking blood. During penetrature, the phlebotomist, I don't know how to say that.
Phlebotomist.
Phlebotomist. A technician who takes blood, inserts a needle into a vein, withdraw blood into a specimen tube, which is sent to the hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow, the antecubital fossa that is easily accessible. She might apply a tourniquet at a tight hand above the side, or the patient may be asked to clench their hand to make a fist. In lightly undressing, usually a piece of gauze to help the blood to cut and to prevent the swelling and hematoma, a black or blue mark or bruise where the vein was punctured.
Okay, thank you so much. Yes, as you can see, this is a description of a taking blood procedure. During venipuncture, the phlebotomist, that is a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube. Here, inserts a needle into a vein, okay, which is sent to the hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow, the antecubital fossa, that is easily accessible. She may apply a tourniquet, that is a tight band, right? I don't know if we have in this image. Well, we don't. Or yes, maybe this one. No, it's not. But we usually saw a tight band or a tourniquet right here, right? About this side. Or the patient may be asked to clench their hand. In this case, this patient is clenching, okay? Do you understand this word, clench, now? Or do you remember what is a fist? Well, fist is this, what this man is doing, okay? And the phlebotomist asks the patient to clench their hand to make a fist. So he is pushing. Is it understood now?
What does clench mean, Ms. Encinas?
Es apretar.
Okay, thank you.
No problem. Okay, in lightly undressing, usually a piece of gauze to help the blood to clot and prevent swelling and hematoma. And what is an hematoma? A black and blue mark or bruise where the vein was punctured. Okay, note, a bruise is a specific mark. Bruising can be used to describe a number of bruises or a larger area. The patient, someone can help me reading this part, please? I cannot read. I cannot see it.
Sure. Do you want me to help you?
Sorry. Okay, now, please.
Okay. Okay.
Note?
Note. A bruise is a specific mark. Bruising can be used to describe a number of bruises or a larger area. The patient exhibits bruising on the right forearm.
Thank you, Jorge. Thank you so much. Okay. So I think this part is understood, right? Do you understand what is a bruise? Or what a bruise means? Nobody? What is a black or blue mark when you hit your arm, for example?
Yeah, teacher, we saw that word in the skin lessons.
I'm so sorry. Can you repeat it again?
We saw that word in the skin lessons, the skin injuries.
Okay, I
Bruise.
cannot listen to you, Claudia. I'm so sorry. I don't know. What are you saying? I don't know what happened with my internet. Can you say it in Spanish?
Que vimos esa palabra en las lesiones de la piel. Es un moretón,
Yes.
un hematoma.
It's just that, moretón, right? Thank you so much.
Okay.
Okay. Any other question? Are you agree with this procedure, or do you think you can add something in your experience, or maybe there is something that you just don't do? Because I think everyone, if not the most of us, took blood sometime, right?
Yes.
Well, teacher, I usually to obtain a vein to introduce a venous catheter. I usually punch a little the vein.
Okay. Yes, I saw it once. In order to?
In order to introduce a venous catheter, the IV.
Okay, thank you, Claudia. Yes. Anyone else that wants to add something? Okay, nobody. Can we continue then?
Yes, Ms. Encinas.
Oh, sorry. Thank you, Sergio. Okay, so once we took blood, we send it to the laboratory tests, right? And they will give us the results. We're gonna ask some of these tests in case we needed to know or to get a diagnosis. Just to mention, we have here more of them. A microbiology request form. It should look like this. Okay, on the other hand, we have a biochemistry and hematology lab report, right? And we can see that we have a value, the range, and the unit. Here, we will see what is important to us. Okay, if we have this sign, positive, we could understand that it's up, elevated, high, or raised. Okay, if we have the sign negative, we can say that it's down, low, or reduced. For example, potassium is within normal limits, or potassium is normal, or maybe potassium is unremarkable. And we have some abbreviations here. Unit abbreviation, G/L, and the full form means grams per liter. We have the L/L, and the full form liters per liter. We have this here, okay, and we can read as times 10 to the power 9 per liter. We have the abbreviation FL, femtoliters, that I don't know in which cases we use this, but maybe you know, and you will tell me later. We have this one, millimoles per liter. This one here, that are micromoles per liter, and U/L, units per liter. Okay, does anyone knows in which cases we use this femtoliters or millimoles, maybe? Okay, I know you know.
Well, I am not sure, but that unit abbreviation appears in the test of laboratory, for example, an hemogram, or when is the test that evaluate the level of the electrolytics, electrolytos, for example, sodium, potassium, chloro.
Okay.
That expressed in millimoles per liter. Yes, teacher.
Okay, thank you, Rina. Thank you so much. Carla Calle.
Good night, teacher. Femtoliters in, I don't know how to say it in English, volumen corpuscular media. It's the size of the erythrocytes.
Okay, the size of erythrocytes. Thank you, Carlita.
Yeah.
It's good to know. Thank you so much. Okay. I don't know if someone else wants to add something. Oh. Okay, can we continue then?
Yes, teacher.
Thank you so much. Well, we have the endoscopy. Mateo, can you read this part, please? Mateo is not here. Okay. Melanie?
Yes, miss, can you listen to me?
Yes, now I can. Can you read this part for us, please?
Yes, miss.
Thank-
Endoscopy. Function of endoscopy. Endoscopy is a way of examining parts of the body which are not visible from the outside. A typical endoscope is a flexible tube which is inserted through one of the natural orifice openings such as the anus or mouth. Rigid endoscopes which cannot be bent several channels to transmit light from the outside and images from inside, and to allow different instruments to be used. To provide diagnostic information, to excise, cut out diseased tissues or growths such as polyps, to clear obstruction, to take a biopsy, to cauterize a site of bleeding by applying heat.
Okay, thank you so much. Once again, functions of endoscopy. Endoscopy is a way of examining parts of the body which are not visible from the outside. A typical endoscope is a flexible tube which is inserted through one of the natural orifices or openings, such as the anus or mouth. Rigid endoscopes, which cannot be bent, several channels to transmit light from the outside and images from inside, and to allow different instruments to be used. Okay, and to provide diagnostic information. To exist, that means to cut out diseased tissue or growths such as polyps. It is only used to clear obstructions, to take a biopsy, and to cauterize a site of bleeding by applying heat. Well, we have here on the right side an image where we can see the endoscope. We have the parts, the eyepiece, the flexible tip fitted with lens or camera, the active part. We have a flexible shaft containing image channel and channels for light, air and water, instruments and wires. Okay. And here we have an image of how it works on the stomach. And we can something else, or maybe something is not good here. Is that how it works in your countries?
I'm sorry, teacher, I can't hear you. Could you repeat again?
Yes, of course. I don't know if you are agree with this procedure, or do you want to add something, or maybe something in some step that is not used in your countries?
I think in this country, in El Salvador, the endoscopy is very useful for the diagnosis in certain disease. But here, in general, the person use especially use the anesthetic drug for the procedure.
Okay. Okay, thank you. Topic, anesthesia, or what type?
Depends the condition of the patient. Especially use anestésicos locales. I don't know, in spray.
Local anesthesia. Okay.
Local anesthesia, yes. But if the person is anxious, or it's a person that cannot cooperate with the local anesthesia, then they use the general anesthesia for that.
Okay, perfect. Claudia, maybe you can tell us more of this?
Yeah, I think it's the same case in Bolivia. Usually, if the person is not anxious and collaborate with the study of the endoscopy, it can be done with a local anesthesia and spray of that with lidocaine at 2%. But if the person is anxious or have another conditions like heart problems or respiratory diseases, yeah, a condition is to have a sedation or general anesthesia of short duration.
Okay, thank you so much. And I'm curious about this. Where do you make the punction of the anesthesia with lidocaine?
No, the lidocaine with 2%, it's an spread as
Oh, okay.
yeah, as the
I
other
understand
partner
now.
mentioned it. Yeah, so you can spray over through the throat, so the patient can tolerate and goes very well.
Okay, perfect. Thank you so much.
Thank you.
Does
Teacher.
anyone else wants to add something? Okay. Let's go to the other part. The enteroscopy. For this, Carla Barta, can you read this part, please?
Okay. Enteroscopy. Now I am just lubricating the tube with a jelly which contains a local anesthetic. It helps to ensure a smooth passage as it passes down and you shouldn't feel too much. I'm going to feed the tube through your nose. This is the most uncomfortable part of the procedure, but it's very brief. You'll get used to the tube in a few minutes time. Okay, when it hits the back of your throat, take a deliberate swallow. I'll tell you when. Now swallow, swallow. That's it. Well done.
Okay, thank you so much. This word is swallow, okay?
Okay.
And, okay, thank you, Carlita. And I don't know if you understand the procedure here. Or do you think you can describe it in another way? I will read it again. Now I'm just lubricating the tube with a jelly which contains a local anesthetic. It'll help to ensure a smooth passage as it passes down, and you shouldn't feel too much. I'm going to feed the tube through your nose. This is the most uncomfortable part of the procedure, but it's very brief. You'll get used to the tube in a few minutes. Time. Okay, when it hits the back of your throat, take a deliberate swallow. I'll tell you when. Okay, and we have the procedure. Oh, I think it's too bad for the patient. I don't know if you want to add something else in this procedure, or maybe it works in another way in one of your countries.
No. Here is the same procedure, even though the expression now swallow, swallow, it's very common to use.
Okay. And I can imagine, I don't know, that you ask your patients not to eat or to eat anything, right?
Yeah.
Before coming to this procedure.
Yes, in a procedures ordinary, the person we tell the patient not eat for that procedure. But in an emergency situation, it's very complicated because the person probably eat or not, but yes, it's very uncomfortable for the patient.
Yes, it seems to be. Thank you, Rina. Anyone else wants to add something or ask something? Okay, I think it's clear. Can we continue then?
Yes.
Thank you. Or no? Okay. Then, Jethro, can you help me here to read this part?
Yes, teacher. Report of diagnostic endoscopy. Examination. Informant consent was obtained from the patient after discussing risk and benefits of the procedure. The patient was connected to the pulse oximeter and placed in the left lateral position. Oxygen was provided through a nasal cannula, and the premedication administered as stated. The endoscopy was introduced into esophagus. At the end of the examination, the patient was transferred to the recovery area to recuperate.
Okay, thank you so much. Well, what we found on this examination, informed consent was obtained from the patient after discussing risk and benefits of the procedure. The patient was connected to the pulse oximeter and placed in the left lateral position. Oxygen was provided through a nasal cannula and the premedication administered, as stated. The endoscope was induced into the esophagus. At the end of the examination, the patient was transferred to the recovery area to recuperate. Okay. I don't know if you have another thing to add here. Maybe that we're missing something. Or on your experience, you should add something here. Or maybe it's okay. Do you agree with this?
Yeah, teacher. Well, to add something, endoscopies are very common in children because they usually throw coins of 1 Boliviano, 50 cents, you know. So it's very, very common to do this procedure in children too.
Okay, thank you, Claudia. So if it's really common, maybe this is for an adult. This form is for an adult. What do you think we have to add here for a child? Or it's the same?
No, it's not the same because the airway management, it's complex in children. They are more usually presents laryngospasm. So the airway management, it's different. Sometimes you had to intubate them before to do the procedure. So it's more complex in children.
Yes, I think. Okay. Thank you so much, Claudia. Is there any question for vocabulary here? Nothing? Everything is understood?
Yes, teacher, no question.
Let's continue then. Well, we have to talk about X-ray and CT now. For this, Jorge, can you read this part, please?
Okay, sure. X-ray and CT. Radiography and radiology. Radiography involves exposing a part of the body to a small dose of radiation to produce an image of the internal organs. Organs with high density, such as the ribs and spine, are radiopaque, meaning they do not absorb radiation and appear white or light gray on the image. Lung tissue is radiolucent, absorbs radiation and appears dark on the image. Before some types of X-rays, patients are given a liquid called contrast medium, such as barium or iodine, which is radiopaque and allows the organ or tissue it appeals to be examined. The contrast medium may be swallowed, introduced through the anus as enema, or given as an injection. Radiology is the use of radiation in the diagnosis and treatment of diseases such as cancer.
Thank you, Jorge. Thank you so much. Okay. I don't know if you have any questions for vocabulary here. Nothing? Someone can tell me, oh, yes, Rina.
Teacher, the part when says when white or light gray, that means the image, how I can see the image. Or in Spanish, radiolúcido, radiopaco.
Yes, yes, that's right, Rina.
Thank you.
Thank you. Okay. The other thing was, do you think what is iodine? Here. Do you know the meaning? You can tell me.
Yodo.
Yes. Okay. That was understood then. Any other questions? And I don't know if someone wants to add something else here in this description. Nobody? Everything is clear?
Yes, teacher, it's clear.
Okay, thank you so much. Well, let's continue with the X-ray examination. Rina, please, can you read this part?
Yes. X-ray examination. The chest X-ray is the commonest diagnostic X-ray examination. Normally, a frontal anteroposterior view is obtained. The patient stands facing the photographic plate with the chest pressed to the plate, with hands on hips and elbows pushed out in front. The radiographer, the technician who takes the X-ray, asks the patient not to move, then to breathe in deeply and not to breathe out. This makes a blurred, unclear X-ray image less likely and improves the quality of the image, as it is easier to see abnormalities in air, filled, inflated lungs, the deflated lungs. And for a side or lateral view, the patient is asked to stand sideways to the photographic plate with arms raised. A chest X-ray may be repeated at intervals to track for any changes. These repeated examinations are called serial chest X-ray.
Okay, thank you so much. Well, here there is a description of how we usually make an X-ray examination. The chest X-ray is the commonest diagnosis. So normally a frontal or anteroposterior view is obtained. The patient stands facing the photographic plate with the chest pressed to the plate, with hands and hips and elbows pushed out in front. The radiographer, that is the technician who takes the X-ray, asks the patient not to move, then to breathe in deeply and not to breathe out. Okay, so I know you're not the ones who take this kind of examinations, but in your experience, do you think we can add something else here, or is the same in your countries?
It's the same teacher here.
Perfect. In El Salvador. What about Peru, Bolivia? Nobody? Well, then, do you have any questions for vocabulary here? Then, can we continue?
Yes, teacher.
Okay, thank you. And here, Ale, can you read this part, please?
Sure. Computer tomography. Here is an extract from a hospital press release. The Western General has installed a new GE Lightspeed 16 computer tomography CT scanner. CT uses an X-ray source which route around the body to produce a cross-sectional images. The new scanner takes up to 16 simultaneous cross-sectional images slides and transmit more data in less time than ever before. Each slide can be less than 1 millimeter thick, making it possible to find very small abnormalities. The scanner will be used for diagnosing muscle and bone disorders, location tumors, infection, and clots, monitoring the process to malignant disease and the response to the therapy or treatment, proving accordance and interventional procedures such as biopsies and drainage, remove fluid from the site and of an injury or infection.
Okay, thank you, Ale. Once again, computed tomography. Here is an extract from a hospital's press release. Okay, the Western General has installed a new GE, what is a light speed 16 computed tomography or CT scanner. CT uses an X-ray source which rotates around the body to produce cross-sectional images. The new scanner takes up to 16 simultaneous cross-sectional images or slices and transmits more data in less time than ever before. Each slice can be less than 1 millimeter thick, making it possible to find very small abnormalities. Okay, the scanner will be used for diagnosing muscle and bone disorders, locating tumors, infections, and clots, monitoring the progress of malignant diseases and the response to therapy as a treatment, providing accurate guidance for interventional procedures such as biopsies and drainage. And what is the meaning of drainage? Removing fluid from the site of an injury or infection. Okay, do you have any questions here? Maybe for vocabulary? No questions? Everything was clear?
Yes, teacher.
Andres, can you read this part, please?
Yes, teacher. MRI and ultrasound, magnetic resonance imaging, MRI, is safer than X-ray because it doesn't use radiation. It provides more information than computed tomography about some head, neck, and spinal disorder because the images are more detailed and have more contrast, meaning the difference between dark and light areas are stronger. Unlike CT, the images can be taken on any plane, any surface, and the body seen from an angle. It is now used for taking imaging of the brain and hair and in oncology. Contradictions case in which it should not be used include patients with metallic foreign bodies in the orbits and patients with pacemakers, electronic device surgically implanted to regulate heartbeat. MRI is also not approved during the first trimester of pregnancy.
Okay, thank you so much. Once again, magnetic resonance imaging or MRI is safer than X-rays because it does not use radiation. It provides more information than computed tomography about some head, neck, and spinal disorders because the images are more detailed, and have more contrast, meaning the differences between dark and light areas are stronger. Unlike CT or computer tomography, The images can be taken on any plane, any surface of the body seen from an angle. It is now used for imaging talking images of the brain and heart and in oncology. Contradictions, cases in which it should not be used, include patients with metallic foreign bodies in the orbits and patients with pacemakers, electronic devices, surgically implanted to regulate heartbeat. MRI is also not approved during the first trimester of pregnancy. Okay, do you have any questions here? Do you understand what is a pacemaker?
Yes, teacher.
Can you explain to us, please?
Pacemaker in Spanish is marcapasos. It's for regulate heartbeat of the patient.
Okay, thank you so much. Thank you, Andres. Okay, do you have any questions here?
No, all is clear.
Perfect. I think we are gonna stop here because we don't have enough time. But I will send to you my questionnaire. Please let me know if you can see it.
Yes, I can see it, Ms. Encinas.
Thank you, Sergio. Can you fill it for me, please? Okay, 7, 9, 3 more, please. Two more, please. One more. Okay. I will take a picture and then I'll let you go. Thank you so much, guys, and see you tomorrow. Remember your schedules, right?
Yes, teacher.
Perfect. And one more. Thank you so much. See you tomorrow then. Thank you for coming. Take
Bye.
care.
Hey,
Bye.
teacher. Bye.
Thank you.
Good night, Ms.
teacher.
Encinas.
Bye.
Bye.